EPS in intraventricular conduction delays. HV interval in bundle branch block. HV interval could be normal in right bundle branch block, with or without additional fascicular block, if conduction is normal in the remaining fascicles. Prolonged HV interval, however, is found in 50% of right bundle branch block plus left anterior fascicular block. In left bundle branch block, HV interval might slightly prolong, therefore, HV up to 60 millisecond in the presence of left bundle branch block should be considered normal. Catheter manipulation in the left or right ventricles can in itself produce marked prolongation of HV and varying degrees of AV block and/or bundle branch block, which is usually temporary. Even complete heart block can occur during right ventricular catheterization in a patient with pre-existing left bundle branch block, or during left ventricular catheterization in a patient with pre-existing right bundle branch block. As seen, HV is prolonged after ventricular mapping. Conclusion: the HV interval is nonspecific. It could be normal in the presence of actual disease, even when conduction proceeds in only one fascicle. It could be prolonged due to catheter manipulation, with no actual intraventricular block. Localization of the site of bundle branch block. Mapping and measurement of activation times at different areas may help define the site of bundle branch block. This is usually easier in the right than in the left ventricle, because the left bundle branch rapidly fans out over the entire left ventricle. Diagnostic maneuvers. Atrial extrastimulation. Atrial pacing. His bundle pacing. Ventricular pacing. Procainamide challenge. Atrial extrastimulation, AES. AES is useful to study the electrophysiological properties of the His Purkinje system. Its refractory period is normally less than or equal to 450 millisecond, and shortens with shortening AES coupling interval. An abnormal His Purkinje system, with a higher risk for progression to AV block, is indicated by a grossly prolonged refractory period, and/or a paradoxical prolongation of refractory period in response to shortening of AES coupling interval. Atrial pacing. Normally, during incremental rate atrial pacing, shortening of the His Purkinje system refractory period with shortening pacing cycle length facilitates 1:1 AV conduction. Abnormal response, that suggests a high risk for progression to high-grade AV block, is the development of second or third degree AV block at His Purkinje system level, at pacing CL greater than 400 millisecond, pacing rate slower than 150 per minute, in the absence of changing AH interval, to exclude AV node disease. His bundle pacing. Normalization of QRS during His bundle pacing, is suggestive of His bundle disease, proximal to the pacing site, while the His bundle distal to the pacing site is healthy, and conducts normally. Ventricular pacing. Assessment of retrograde VH, or VA, conduction is not useful as an indicator of anterograde His Purkinje system reserve. Procainamide challenge. Abnormal HV interval responses to procainamide, representing evidence of a higher risk for infra-His AV block, include doubling of HV interval, prolongation of HV to greater than 100 millisecond, and/or development of second or third degree infra-His block. Thank you.